Attention, chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino from ChiroEdge, and welcome to this week's episode of the Chiropractic Research Breakdown, where each week, we break down the science and philosophy needed to empower you to change the health of your community from the inside out. Today, we have 3 case studies we're going over. We're going to be going over a case study on seizures, published in the Journal of Pediatric, Maternal, and Family Health. We are going to be looking at bedwetting from the Journal of Clinical Chiropractic Pediatric. That's the ICA's journal. And a journal I've never seen before from Hong Kong has a case report on something I've never heard of before. It's in British Medical Journal. Oh, sorry. No, I just haven't heard of this author before. It's in the British Medical Journal. Okay, cool. So, as always, you can get information just like this to your inbox each week with your office brand, with your logo, your information, your website, in friendly patient newsletter educational format by going to our website, ChiroEdgemedia.com, where we have a 2-week free trial for you. So first thing we're going to look at is resolution of chronic seizures in an infant undergoing chiropractic care for vertebral subluxation, a case report, and review of the literature. This is by Dr. Nicole McCauley. So seizures. Patient in the case was a 15-month-old male. History of traumatic birth, including C-section and epidural. The infant began experiencing seizures at 6 months of age, with episodes occurring 2 to 3 times weekly and lasting 1 to 2 minutes. So 2 to 3 seizures a week, 15 months old. So it's been going on for started at 6 months, so we've been going on for about 9 months at this point. Child was born via C-section. We'll go a little bit of history. Mom experienced preterm labor, had a history of preterm labor with 2 prior pregnancies, resulting in the delivery of the first child at 25 weeks, who subsequently passed away. She had progesterone shots administered to avoid preterm labor. 5 ultrasounds were performed during the pregnancy, and she experienced morning sickness and back pain during pregnancy and was hospitalized twice for preterm contractions. This brings me back and reminds me of the Marcia Schaefer ICPA seminar that's awesome on basically infertility, on prenatal care and nutritional aspects. And something that she says that really hits me is, we always have this focus around having babies, right? Even in chiropractic, we always talk about, just simply, this many women got pregnant, whatever it is. But the conversation needs to be shifted when we talk about this. It's not just about having babies, right? It's not just about taking infertility drugs. It's not just about doing these things. But rather, what we really should focus on is having healthy babies. So the delivery was via C-section at 37 weeks with an epidural administered. No fetal distress or meconium. Infant cried strongly, was pink all over. The boy was fully vaccinated, of course, which is, just fantastic. Had a history of occasionally and purposefully hitting his head. This is after the seizures had started. When we think about it, one of the educational pieces that we bring up to a lot of parents is that while you may, experience something like, let's just relate to them with the neck pain. You can choose, you have the willpower as mom or dad or an adult, you can choose to ignore that, and you can choose to go throughout your day, and you can make the choice to live with that pain, that issue, that subluxation, that interference, whatever you want to call it. Babies, kids, they don't have the development of that willpower yet. If something bothers them, they're not gonna do it. If they're subluxated and they can't turn their head to the right, they're not going to force themselves to turn their head to the right to breastfeed. They're just not going to do it. If they have a subluxation present and it's shifting their cranium in the wrong direction, they're going to start to bang their head because innately they know that they can change it and they can fix it. And they're trying to put a proper force in. So this all starts to make sense. So the boy was adjusted to reduce subluxations. He had cranial adjustments 17 times over the course of 8 months. A mixture of activator instruments adjusting along with sustained contacts were used. The patient parents were also instructed in exercises that included the use of a paintbrush to stimulate bilateral plantar surfaces of the feet and bilateral cheeks. They were instructed to play with lateral proprioception in mind. They were given exercises that included rolling on a ball, on belly, on knees, on feet, and bounce on a ball, on belly, on knees, and feet. They were instructed to avoid sugar, wheat, and dairy because, of course, gotta do that in a chiropractic office. Over the 8 months, the boy experienced a couple of instances of head trauma, colds, and congestion. And over the course of those 8 months, the seizures went from 1 to 2 times a week for 9 months. 2 to 3 times a week for 9 months to being completely resolved. Nice and easy case study. Something to think about. It's 3 pages, but it's a life changed. Next thing, ICA's journal, Journal of Clinical Chiropractic Pediatrics, from Dr. Anissa St. Jean. I don't know. She's from Ontario. Sounds French. I don't know French, although I did have French onion soup for my wife's birthday on Saturday, and it was awesome. Chiropractic care of a 10-year-old female with... Please tell me you love that joke. Moving forward. Chiropractic care of a 10-year-old female with primary nocturnal enuresis. A case report. So nocturnal enuresis, or bedwetting, is defined as the involuntary loss of urine during sleep without organic disease at development of 5 years or older. It occurs in 15 to 20% of children of 5 years of age. So easy way to remember that. 1 in 5 children aged 5 have bedwetting. 1 in 5 children. It occurs in 1 to 2% of 5% of children 10 years of age and 1 to 2% of children 15 years of age and older. Something really important to keep with you. Without any treatment, about 15% of bedwetting children are spontaneously cured each year. So 15% each year. So just kind of hold that with you before we go and claim, like chiropractic cures bedwetting. No, chiropractic allows the nervous system to function at 100% of its best, and oftentimes many of the issues that people come in with, they just don't have to have because it's just simply the result of their body not functioning 100%. So there's things that I like and don't like about this case study. The design of the study, it was in the form of a case report. She was 10-year-old female who her mother brought her in for initial chiropractic evaluation, seeking a second opinion about her unsuccessfully treated nighttime bedwetting. She reported never experiencing a dry night. 10 years old, I want to repeat that. 10 years old, never experienced a dry night. 10 years old, never experienced a dry night. And this is really important here. The quantity of urine was more abundant when she would sleep outside the home or be in stressful factors at school. So subluxation lessens the body's ability to adapt to and overcome physical, chemical, emotional stress. So it just so happens that these symptoms were more present when she was unable to adapt to physical, to chemical, and to emotional stress. Makes sense. Her daughter slept with pull-up diapers since she was 5 years old. Her primary medical doctor treated her with 60 micrograms of desmopressin once per day for 12 weeks without any change. So 2013, they first became aware. Behavioral therapy for about a year from 2013 to 14. Ultrasound and urine tests in 2014 to 15. 2015 to 16, she began desmopressin for 12 weeks. They decided to wait and see till 2017, and that is when chiropractic care was initiated. So it started in 2013. In 2017, chiropractic care was initiated, 14 visits over the course of 10 weeks. They follow up once a month, and in March 2018, all of the bedwetting had completely resolved. So they go on to describe why this may happen. So in chiropractic, vertebral subluxation is considered to be a biomechanical change in the spinal column that causes neurological dysfunction. The urinary bladder is supplied by both autonomic and somatic nerves emerging from the lumbopelvic region of the spine. Control of the detrusor muscle, which causes bladder emptying, and external urethral sphincter originates from the S2 to S4 segments. I read this and I got a little bit nervous because I was like, are they just going to go ahead and say that sacral manipulation or sacral adjustment is going to be what cures bedwetting? And they don't say that straight up, but they kind of go that direction. So they say Rodnick and Rodnick provide evidence that neurological deficits are restored to their normal function by performing subluxation correction in the areas of sacral segments of the spine. Based on this hypothesis, the relationship between bedwetting in this case and the range of motion of the sacral joints supporting this reasoning with the sacral-based dysfunction of the patient. So the treatment was based on the diversified technique and consisted of the manipulation of the sacrum using HVLA. I hope that they analyzed, which they said they talked about muscle tension and stuff like that. But it's why are we not just addressing all subluxation? Why are we not talking about subluxation as interferences of the nervous system from the brain to the body and everywhere? Why do we consistently have this mechanistic approach when we look at things and say the nerves from the sacrum go to the bladder, so if we adjust to the place where the nerves go to the bladder, then it's going to do better? That is mechanistic. That is not vitalistic. That is not chiropractic philosophy. And I'm sorry if you disagree with me, but that's my belief. So they were seen twice a week, total of 14 treatments. After the first week of treatment, improvement was noted with the patient reporting 2 consecutive dry days. A reevaluation of the right sacral base revealed greater joint motion and decreased tenderness of the psoas. Third treatment, diary reported she was no longer waking up with fully wet pull-up diapers. On the 5th treatment, the child had been sleeping without bedwetting for the first 4 nights. She was very happy and proud to show her bedwetting evolution in her diary. On the 8th treatment, she reported the week before she had regressed, and she woken up on 2 mornings with full diapers. Her mother reported that she had been actively participated in family parties and had gone bed to the late on the weekends previous, so increased emotional stress and there was regression. Who would have thought how much retracing just happened in your practice during Christmas season when that high emotional stress is through the roof? I wonder. More emotional stress to adapt to. Make sure you're communicating that to your practice members. So, she'd also succumbed to influenza and was prescribed 10 days of antibiotics. On the 12th and 14th visits, it was reported that the child had been bedwetting free and uresis free. This was the longest dry period in the patient's lifetime at 10 years old. A positive change was noticed in the child whose mood was improved. There was also a resolution of restriction in the joints of the sacrum upon chiropractic motion palpation. So interesting stuff. Reading. Just be clear on your communication, man. Like, I love research and I love this stuff and I love reporting on these cases. But sometimes, while it might be scientifically sound, it doesn't necessarily mean that it's philosophically sound. And that's, the difference between chiropractic and every other profession is our philosophy. So let's hold it true. Which brings us to our last case from the British Medical Journal. It's cool to see chiropractic talked about in the British Medical Journal. And this is something called neck-tongue syndrome, which I had never heard of. So it's just a case report. And it says neck-tongue syndrome is a rarely reported disorder. It's characterized by brief attacks of occipital pain and ipsilateral hemiglossal diaesthesia elicited by abrupt neck motion. Basically, if they turn their head quickly, they get really bad occipital pain, and part of their tongue goes numb. Crazy. It can occur without obvious abnormalities, but it's associated with pathological changes such as degenerative spondylosis, ankylosing spondylitis, psoriatic arthritis, and loose ligaments of joint capsules. So, what's pretty cool here is when we look at chiropractic, we have no idea what the heck the syndrome is, but we know that if there's interference present, it's going to affect the function of the body. So if we correct that, the body's going to go ahead and improve. The 47-year-old man sought chiropractic treatment for paroxysmal episodes of right hemicranial pain and tingling of the right base, and ipsilateral hemitongue for 3 months. He had a dry cough, his headache, blah, 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 blah. All right, cool. Pains were brought out by abrupt head turning to the right, any forward neck gliding or chewing, and they lasted a few minutes. So that's when they diagnosed him with neck-tongue syndrome, which is an arbitrary diagnosis. The first phase of chiropractic regimen was mobilizing the restricted joints to release what was reasoned to be an impacted nerve. So it's so funny because this is from actually published by by the Chiropractic and Physiotherapy Department at New York Medical Group in Hong Kong. So it's funny to hear how they address the term subluxation. Is they describe it as mobilize restricted joints to release what was reasoned to be an impacted nerve. Yeah, there's nerve interference, guys. Like, that's just funny that they don't just use our language and they try to describe it in the most basic form possible, which probably isn't even 100% accurate. The cervical musculature was appropriately stretched, of course, before spinal adjustment to ensure the NTS was not provoked. He was treated 3 sessions per week. Following 12 sessions, pain frequency and intensity had decreased. Treatment program included ultrasound therapy over the right face, trigger point therapy of the right temporalis. Following 24 visits, the painful episodes had disappeared and range of motion had increased. There was minimal diaesthesia in both the right face and right tongue. Since the patient is significantly improved, he was given a home exercise program and monitored because, why not provide wellness care to overcome the very same things, the physical, chemical, emotional trauma that brought him into this place in the first place. So looking at this stuff, guys, just kind of, it's cool to see when we put the body in the right place, when we adjust it, when we correct interference, how well the body is able to heal regardless of what language we use, regardless of the technique that we use. It's cool to see the words chiropractic coming out of a place like Hong Kong, seeing that we're really going and making a huge difference around. It's just really important that we use our own language, that we communicate in the way that we should, because if you were to look at that case study, we don't know if chiropractic errors would help or if it's the other things that they did that helped. We don't know a lot of things. We don't have wellness care, so I would love to see what follow-up on this is, because he just has a home exercise program, but unfortunately, a home exercise program is not going to help the major traumas, minor traumas, chemical traumas, and emotional traumas, the traumas, toxins, and thoughts that this 47-year-old man will be experiencing as he continues to live his life. So anyway, with that, I hope that took this information on bedwetting, seizures, and neck-tongue syndrome with you today to know that when the body's in the right place, when we correct interference in the nervous system, its ability to heal is amazing, and it's greater than anyone could imagine. Regardless of and the reason I included this weird thing about neck-tongue syndrome is to say, regardless of the diagnosis, regardless of the label, regardless of this, regardless of that, if you correct the interference, allow the brain and body to communicate better, the body will improve. Take that with you. You're not crazy to tell your community about subluxation. You're only crazy not to. If you want to continue have this stuff, you want to grab information like this in well-written patient newsletter format for your practice every week, complete with your brand and logo, go ahead and grab a true 2-week free trial on our website at ChiroEdgeMedia.com. And if you're going to be at the AMPed conference this weekend, January 25th to 27th, come see us. We're going to have a booth. I cannot wait to see you there. Once again, Dr. Anthony Pellegrino from ChiroEdge. Go out there and slay some subluxations.